Hi everyone, my name is Salima Al-Madziva and I am a Hubert Humphrey Fellow at Rollins School of Public Health. My presentation topic overlaps with my professional interests, so I will briefly tell you about the evolution of health technology assessment in Singapore pharmaceutical policy. According to the outline, I will try to describe it briefly but pithy, with a focus on the key decision-making processes in healthcare in Singapore and how the health technology assessment, abbreviated as HTA, influences these decisions. Some details of the health financing or the role of HTA bodies, challenges, and the main conclusions will be provided. Let's rewind a bit of the previous class about Singapore. In Singapore, everyone has an access to healthcare. There is universal health coverage through a mixed financing system. About 70 or 80% of citizens obtain public medical care, and non-residents are provided for options of private insurance. Singaporean public healthcare services are situated across the island within three integrated clusters: National University Health System, National Healthcare Group, Singapore Health Services, and each cluster includes general hospitals, one community hospital, several polyclinics, and medical school to offer a comprehensive range of services comprising acute hospital care, primary care, and community care. It's also important to know that the healthcare financing system is built on a shared responsibility among individuals and families, insurers, and the government. And the current system is a combination of government subsidies, compulsory individual healthcare savings accounts like the named MediSave, risk pooling via both voluntary, private, and mandatory government health insurance plans named MediShield Life, and out-of-pocket contributions from patients and a government endowment fund that acts as a safety net for the needy, named MediFund. And in the context of pharmaceuticals, government subsidies help ensure access to affordable and effective treatments for common medical conditions for subsidized patients, or while the national insurance scheme named MediShield Life, it reduces the cost burden of treatments for inpatients and selected expensive outpatient treatments such as cancer chemotherapy or immunosuppressants for transplant recipients. However, despite a successful healthcare system, which is efficient and has a high quality, Singapore faces similar global fiscal challenges like aging population or increasing burden of chronic diseases and growing demands from citizens for expanded healthcare services, leading to rising healthcare costs. And in general, it's a burden for budget. For example, drug expenditures in 2013 and 2016 in public sector increased by 25%. American dollars. In American dollars, it will be about 296 million, and it is the minimum, and it might be up to $370 million. Drugs are regulated by the Health Science Authority, HSA, to ensure that they meet specific efficacy, safety, and quality standards before they are marketed in Singapore. And usually the process of marketing authorizations of drugs takes approximately 9 months. And there are no price controls on drugs at the point of marketing authorization, so that any patients who can afford to pay for a drug have access as soon as it's made commercially available by the company. There are also available subsidies and financial assistance schemes for drugs for eligible patients, which the drugs should be included in the standard drug list and medication assistance fund. The standard drug list was established in 1979 and was modeled after the WHO model list of essential drugs, with slight adaptations to local disease profiles and practices. As of February 2018, a total of 568 drugs were included on the SDL, Standard Drug List, representing therapies essential for the management of common diseases affecting the majority of patients. Also, drugs on the SDL list are subsidized at 50% for all Singapore citizens who are patients in public healthcare institutions. And patients from lower to middle income households can receive a higher subsidy, which is up to 75%. The list is reviewed periodically and it takes into account changes in clinical practice and advances in medical science. Another financial assistance scheme named MAF or Medication Assistance Fund helps eligible Singaporeans pay for high-cost drugs that are not on the standard drug list but have been assessed to be clinically effective and cost-effective. Drugs are listed on the Medical Assistance Fund with specific clinical criteria to ensure appropriate use. Eligible patients can receive up to 75% assistance of Medical Assistance Fund drugs if they are from lower to middle income households based on means testing. As of February 2018, there were about 47 drugs listed on the MAF list. Other lists improving affordability of treatment for patients include the Pioneer Generation packages for patients aged 65 and older, through which seniors are eligible for additional drug subsidies. Another one is Medisave, which can be used for outpatient treatment of chronic conditions such as diabetes and stroke at public healthcare institutions and participating private general practitioners under the Community Health Assist scheme. It's MediShield Life, which provides coverage for all Singaporeans for ward charges and medical costs associated with inpatient treatment and for specific costly outpatient treatments such as dialysis and oncology drugs. Finally, MediFund assistance is available for low-income Singaporeans who require further financial support to pay their medical bills. Considering the important role of HTA in pharmaceutical policy in Singapore, we should know that HTA is not new to Singapore. It was started in 1995 by the Ministry of Health. They tried to evaluate the benefits, risks, and clinical effectiveness of select health technologies to inform policymaking for the management and planning of health services in the country. And subsequently, in 2001, the Pharmacoeconomic and Drug Utilization Unit was set up to support the Ministry of Health Drug Advisory Committee, DAC, with evidence-based drug subsidy recommendations. To ensure long-term sustainability of the Singapore healthcare system, Ministry of Health established the Agency for Care Effectiveness, ACE, in August 2015 as the national HTA agency to consolidate and further expand health technology assessment capacity to drive better decisions. In addition to the HTA capacity within Ministry of Health and ACE, the agency, the integrated healthcare clusters also have health services, research units with hospital-based HTA capacity where they assist pharmacy and therapeutic committees within each hospital to incorporate HTA principles in managing drug formularies. To inform drug subsidy, Agency for Care Effectiveness uses methodologies, including experience from overseas HTA agencies in Great Britain or Canada. They also use specific decision-making framework and which consists of special criteria. ACE didn't invent something new, but they contextualized all existing experience and methodologies to the Singapore settings. And they use potential drug topics for technology evaluation. Consider all factors, including clinical need for the new treatment, or its therapeutic benefit over current standard of care, or disease severity, population size, and estimated budget impact to the government. We also use upper and lower limits of the base case incremental cost effectiveness ratio, specifically derived from sensitivity analysis, and we also take into consideration quantitative estimates. It is noticeable to see the great impact of HTA on Singaporean healthcare system because it serves to target funding to the cost-effective drugs. Moreover, government and ACE use value-based pricing negotiations, which are shown in the next slides, and where it's also mandatory to make the cost-effective drugs available throughout the country, which were recommended by Drug Advisory Committee, DAC. This is a drug evaluation processes for full evaluations provided by ACE. Evaluations typically take 6 to 9 months to complete. It includes a systematic review of clinical evidence and the development of economic models to derive local cost effectiveness and budget impact estimates. The majority of evaluations, however, follow the expedited processes like rapid review, which usually takes 3 to 4 months, involving a review of published clinical and economic literature, including work completed by other HTA agencies. This situation agency uses such techniques like transferability and generalizability to the local context. So when the Drug Advisory Committee gets the health technology assessments or reports from the Agency for Care Effectiveness, they use a special decision-making framework, including in line with a specific decision-making criteria that considers 4 core principles on the basis of available evidence. It's like clinical need of patients and nature of condition or cost effectiveness, the incremental benefit and cost of the technology compared to existing alternatives. And it exactly proves that the committee uses deliberative process in meetings, within meetings, to make fundamental principles available, where all experts discuss the special appropriateness of value judgments that underpin the evaluation. As any other country, Singapore also faces challenges like advancement of medical technologies, including novel therapies subsidizing immunotherapy or novel gene therapy, or some kind of like cancer therapies, which updates every year. And they also follow the national precision medicine strategy. According to this, we try to follow the new advancements in medicine the whole world. There are also some issues related to HTA capacity and capability building because they still need specialized skills because of lack of professionals trained in HTA. Due to this fact, they engaged a lot of overseas professionals from International Advisory Panel, including people from Australia, Canada, or the UK. And it is very wise because Singapore does not create their own evidence and they don't pay money for new clinical trials because it might be very expensive. So they just derive existing evidence and existing experience and use it in their country. Moreover, they are all members in a variety of networks like HTA Asia Link or INACTA. These networks are highly professional, which means that they provide a platform for experience exchange and education. As a result, Singaporean specialists they stay tuned to new updates in health technology assessment. It is also important to say about monitoring scheme of HTA impact on clinicians and patients' behaviors. Ministry of Health is highly motivated to get feedback from people through targeted educational efforts or by optimizing data analytics using IT infrastructure, which again shows the advancement of the healthcare system and health technology assessment in Singapore. In conclusion, we can say that HT in Singapore has succeeded to inform evidence-based making, including pharmaceutical policy, which has helped to improve access to drugs of good value for all population. And it's very important to know that value-based pricing negotiations is a very important approach in Singapore, but we still have a necessity to expand HTA capacity by harmonization of HTA methods and processes, including data integration, HTA awareness, and understanding increase in the local communities. Where we should also take into consideration that Singaporean government monitors and measures the impact of guidance recommendations, and they gain feedback from clinicians and patients. In general, such approach and such attitude help improve the healthcare system, the quality of medical services, and the quality of medical drugs and health interventions. So it's very nice. More information is provided in the references on the next slide. Thank you very much.